Hi, everyone. Welcome to Wellness with Wendy. My name is Wendy Garvin Mayo. I am a nurse practitioner, oncology nurse practitioner, and I am the founder and owner and CEO of the Stress Blueprint. The Wellness with Wendy show is sponsored by the Stress Blueprint. And I'm so excited to be here with you today. Many of you may be looking for Latasha Ankrum, who is supposed to be our first guest to celebrate Breast Cancer Awareness Month, which is October today. We are currently doing a breast cancer series to talk to patients, men and women who have been diagnosed with breast cancer, to talk about their experience, their journey through treatment, and where they are right now post treatment, or some of them may even still be in treatment. The reason we're doing this series is to bring awareness to breast cancer. Everyone, I'm sure, if you haven't been impacted by some sort of cancer, specifically breast cancer yourself, you know someone who has. Latasha Ankrum will not be here tonight. However, I still want to take the opportunity to come and just bring awareness to Breast Cancer Awareness Month, because it's so important. Today, I actually scheduled my mammogram. So I am scheduled for my mammogram October 31st of this month. And, I want to just encourage everyone, if you are a woman, who is of age to have their screening, please schedule your breast mammogram or ultrasound. And if you are not, and you know someone, encourage your mother, encourage your aunt, encourage your uncle, whomever, to get their screenings. Even if they didn't, it's a great topic of conversation to bring up, to ask, did you get your mammogram or your ultrasound this year? So, one discussion can save many lives. Breast cancer is very common in women. In 2023 of this year, it's estimated that about 298,000 women will be diagnosed with breast cancer, and about 43% of them will die, unfortunately, from their diagnosis. And we can't forget our men. About 2,800 men will be diagnosed with breast cancer this year, and about 530 of them will die from their diagnosis. So, breast cancer is very prevalent, it's out there, and it's taking lives. So, early detection is so important. And we should not just be talking about breast cancer in October, we should be talking about it all year round. But I am taking this opportunity to use this platform this month to talk about breast cancer every Monday at 6 p.m. So we'll have different guests on here, maybe even some caregivers, to come on and just really share their experience. Latasha Ankrum will be here next week, and I'll tell you a little bit about Latasha Ankrum. She is very special to me. She is one of my sister friends, as we call each other. Tasha, I call her Tasha. We grew up in middle school. That's where we met, sixth grade, Phyllis Wheatley Middle School. And we've been friends ever since. She was diagnosed with breast cancer, and I'm not going to go too much into her story because I'm going to allow her the opportunity to tell her story next week. But she was diagnosed with breast cancer, and it really hit close to home for me. And being an oncology nurse practitioner, it was really hard. It was really hard to. At that time, I was in the clinic while she was going through treatment, and I remember a time when I was sitting in clinic with my mask on. It was during COVID, and she called me while she was sitting in her recliner getting her chemotherapy. That moment was it was very surreal. It was surreal because here I am in a clinic taking care of cancer patients, and my friend is sitting in a chair getting her chemo. Still don't know how I feel about that, but it's a moment that I vividly remember, sitting there with my white coat on, my stethoscope, and my mask. And I'm talking to her. And then she FaceTimed me. And I think I actually have a picture of the two of us on the screen. And I think I had my mask on. I remember that image in my head. But it takes really 1 second for someone's life to change, or for someone to experience someone close to them having breast cancer. So that's why screening is so important. But I'm going to allow Latasha Ingram to come in and really unpack her story. But her story is near and dear to my heart because we've been friends for so long. And she's going to talk about, her diagnosis, how she was diagnosed, her treatment, the trials and tribulations she's went through cancer treatment and even post treatment. Because even though there are many treatments out there for breast cancer and many cancers, we don't really talk about the survivorship. Life after cancer, that survivorship, and those individuals go through so much. There's a huge gap that needs to be filled there. So I will allow her to come and tell her story, and I hope it moves someone to talk to someone else about breast cancer. So I won't be on here long. I just want to bring awareness that October is Breast Cancer Awareness Month. Get your mammogram. Tell someone else to get their mammogram. And I also want you to, and I'm huge on this. I'm really big on knowing your history. Have conversations with your family, with your children about history. What is our history? Is there a history of breast cancer in your family, whether it's on the female side or male side? But let's start talking about that. Genetic counseling. Was someone diagnosed with breast cancer? Did they have genetic counseling? What did those results show? How do they impact you? Get an understanding of that. Let's not wait until we have a diagnosis to start moving on these things. There's some things we can do proactively. And I think this is a month to really amplify that on what we can actually do for ourselves and our families. And let's not forget our men. Men are also diagnosed with breast cancer. And we will have the opportunity to talk to some men about their experience being diagnosed, going through treatment and post treatment, and some of the things they are dealing with. There's a lot going on out there, and I am really excited that I get to utilize my platform to really bring awareness to breast cancer and many other things. So that's all I have tonight. Please tune in next week, same time, same place, and we will be talking to Latasha Ingram as our first breast cancer guest. And please look out. I'm going to put some videos up. Latasha and I did a PSA last year for the Color of Wellness, where we recorded a PSA on the importance of getting your mammogram. So look out for that, and please tell someone, ask them about their family history. Ask your family, but let's start the discussion. This is a great month to bring awareness and start the discussion on breast cancer. So with that, take care, and I look forward to seeing you next week.